Welcome back. A new nationwide survey from Included Health and YouGov of finding Americans' top concerns include the cost of goods and services, the economy, and their own physical health. Joining me right now is Included Health co-founder and CEO Owen Tripp. Owen, thanks very much for being here. Tell me about the survey. What were the most important takeaways?
Well, Maria, it probably tells us something that we're not, unfortunately, that surprised by, which is that American healthcare and American workers in the American healthcare system, they're feeling the weight of the world. They're telling us very clearly that while they have options, they don't understand those options. While they can get access to care, they don't really know where to go. And the sources that have been designed for them to understand what to trust and who to trust are falling apart and not serving them.
Yeah, and we saw this just in the most recent economic data that healthcare is increasingly the place where people are spending money. It's not that they're buying stuff, they're spending it on healthcare. The cost of healthcare is a huge concern for consumers. Do you have any tips on how workers can begin to select their health benefits in a more cost-effective way?
Well, this is that time of year, right? We should all be talking about this. This is when we go through what's known as open enrollment. We're picking our benefits, whether we get them from our companies or from our government. And no matter what, you should be picking around high quality. You should be picking around easy access. Too many Americans are finding that they are opting out of care because they simply can't afford it. Our study showed that 27% of American workers are avoiding critical care. Let's make it simple. Let's make it easier to use. Let's make it easy to understand, because the cost, Maria, of not getting the care you need, it can be devastating. Too many Americans have over $10,000 in medical debt. This is the largest source, as you know, of bankruptcy and debt in the United States. We can do so much better. We've got the care. We just need to get people better access to it.
That is a great point. And that's what we saw during COVID. People decide, oh, I'm not going to go get my mammogram. I'm not going to go get my colonoscopy. I'm going to wait. And these have very devastating results. Joe Borelli, jump in here.
Yeah, I want to talk about the GLP-1. This is something that has essentially proven to be helpful towards people who want to do some weight loss. And we know, obviously, the impact of weight, as evidenced by me, is something that makes Americans unhealthy. Why do you think insurance providers are so hesitant to cover it?
Yeah, Joe, you're raising a great point, especially right now. You've got 1 in 4 Americans that are worried about their weight. Many of those people are actually worried and trying to access these drugs, which, to your point, work very effectively. Couple problems. Too expensive for most American employers versus alternative therapies. I'm hopeful that that's going to change over the months to come. And 2, we just have supply shortages. So even when they're indicated, prescribed by a doctor, getting the appropriate amount in the hands of a patient is very challenging. And I guess the third I would probably add is also getting people to stay on these drugs. They do have side effects. They do require injection at this point. They require the person to participate a little bit more actively in their therapy, and I think we've got work to do there.
All right, we will leave it there. Owen, thank you very much for the info. Good to see you. Owen Tripp, stay with us. We'll be right back.